The National Institute for Communicable Diseases has reported 12,371 new COVID-19 infections in the country. For the latest on how we are doing in terms of statistically and the trends, Dr Ridhwaan Suliman is a senior researcher at the Council for Scientific and Industrial Research. A very good evening to you, Ridhwaan. Thanks so much for speaking to us. So let's start with the average daily COVID-19 cases per week in South Africa. I mean, we have been rather anxious to see if there has been a drastic decline.
Good evening, SABC. Unfortunately, there hasn't been a drastic decline, but there has been a decline nevertheless in all indicators. But that decline has unfortunately slowed. This is due to a lesser contribution from the inland provinces, which are on a downward trend, but unfortunately a greater contribution from the coastal provinces, which are certainly on the rise. So if we take a look at the numbers in terms of the number of reported cases nationally, that 7-day average currently stands at just over 10,860 new cases per day across the country over the last week, and that figure has decreased by 4% week on week. So you can see that that decline has certainly slowed, coming down from the peak that we were at about 3 to 4 weeks ago.
Okay. So, Ridhwaan, I want to look at the average daily COVID-19 test positivity per week in South Africa, but I also want to do that against the backdrop of the fact that we know that people are also getting vaccinated, and some are reporting that they've gotten COVID-19 after vaccinating. Is it because of also lack of testing before they get the vaccine? I just want to understand that.
That's a fair point. I mean, I don't quite have the data to be able to fully answer that question, but certainly breakthrough infections do occur because we know that the efficacy of vaccines are not 100% to prevent infection. They certainly do, and the data shows, data from countries across the world show that it certainly helps to prevent hospitalization and death. That being said, I think breakthrough infections do occur, but secondly also it takes time after someone receives a vaccination dose for that immunity to build up. So there is that period in which people are still susceptible. If we look at that test positivity rate nationally, it is still promisingly on a decline, down to 21.7% on average at the moment. That percentage above 20% is still high. It means every 4 to 5 tests conducted is yielding one positive result. The decline, though, is promising. However, again, the rate of decline has slowed in this particular indicator too.
What is the provincial case incidence per province? We know that, as you mentioned, the inland cases seem to be dropping, but there are others, provinces particularly, that are spiking.
Yeah, so Western Cape currently is the epicenter of the third wave in South Africa, reporting the highest number of cases in absolute terms. The province has reported just over 3,100 cases on average over the past week, or scaled by the population size, that's 45 new cases per 100,000 people in that province of Western Cape. So that is high and is similar to the heights reached at the peak of its second wave. However, the rate of increase in Western Cape has slowed a bit as well, up 5% week on week. The other provinces of concern are all along the coast. KwaZulu-Natal new cases have increased by 28% week on week, and certainly no signs of slowing down there. So I think that's a concern and something to watch for the next couple of weeks. Eastern Cape as well is showing, specifically over the last few days, an increase, up now 14% week on week. Northern Cape, unfortunately, is still high, up 10% week on week. And Free State has also plateaued at a high case incidence level. On the good news side, Gauteng, Northwest, Mpumalanga and Limpopo continue on their downward trends.
So I believe, Ridhwaan, of the latest figures, it represents 21.6% positivity rate in the infections Is this reflected in the hospital admissions, especially per week?
Yeah, so we are also seeing a decline in the number of new hospital admissions nationally, following that decline in reported cases and test positivity rate. So the last week saw just over 10,600 new hospital admissions across the country, and that is down 16% week on week. The decline is again largely contributed by the decline in Gauteng and its neighboring inland provinces. The Western Cape now reporting the highest number of new hospitalizations and an increase of 9% in new hospital admissions in that province week on week. There are currently just over 3,600 people in hospitals in the Western Cape, with about 14% of those unfortunately in ICU.
Just finally, we are sitting at close to 75,000 COVID-19 deaths. What is the average daily number of deaths per week in the country?
Yeah, so the number of reported deaths unfortunately remains high. We've reported an average of 373 new deaths per day across the country over the past week, and that figure having increased by 3% week on week. So while the number of reported deaths may not have been as high as the peak of the second wave, unfortunately, if we look at the width of that third wave in the graph, there certainly is a high number of reported deaths over a longer period, as this third wave is lasting for a bit longer. And unfortunately, while we're still seeing a rise in cases in the coastal provinces, because of the lag, we will unfortunately see more deaths, particularly in the coastal provinces. We're already seeing an increase in reported deaths in the Western Cape and in KwaZulu-Natal already in particular.
Ridhwaan, as always, thank you so much for speaking to us. Dr. Ridhwaan Suliman is a senior researcher at the CSIR.